My name is Dr. Andrew Kolodny. I am the Executive Director of Physicians for Responsible Opioid Prescribing, and I'm the Chief Medical Officer for Phoenix House, which is a national nonprofit addiction treatment agency.
My name is Adrienne Abbate, and I work for the Staten Island Partnership for Community Wellness and the Tackling Youth Substance Abuse Initiative.
The CDC has said that the United States is in the midst of the worst drug epidemic in our history.
I think it can be traced to a couple of different factors. One was a period of overprescribing of opioid analgesics by providers and physicians.
So what the CDC is really saying is that in many ways this epidemic has been caused by the medical community overprescribing opioid pain medicine.
I think there was also pharmaceutical marketing that played a role in it. I think that when some of these medications were first being introduced, pharmaceutical companies really kind of aggressively marketed to physicians and made it seem as if that it would be a safe and non-addictive form of pain treatment.
What led to this dramatic change in practice was a campaign loaded with misinformation. So prescribers were led to believe that the risk of your patient becoming addicted to an opioid medication was very rare.
There was, I think, a shifting now, but some social attitudes around acceptability of sharing medications between people and that feeling of not being able to, taking a pill to solve an issue. And so I think that all fed into where we are today.
If you went back to, say, 1995, before the introduction of OxyContin, that was a time when doctors would have been very reluctant to treat common chronic problems with strong opioid pain medicine.
A lot of prescribers and physicians are influenced by what their patients want. So when patients go in and they have read about a medication and they are in pain, they request certain medications, and often prescribers are put in a spot where they feel like they have to treat the pain.
So they'll come back, and when the patient comes to the doctor and says, I saw an advertisement for this or that drug, or visits a doctor and expects to walk out with a prescription, the doctors are interested in having happy customers. And I'd have to say, if you're prescribing lots of opioids to your pain patients, it's a business model that works out pretty good for the doctor. You've got a patient, because the drugs are addictive, because you become physically dependent on them, you've got a patient who's never going to miss an appointment. You've got a patient that will pay their bill on time, they'll be there at every appointment. They're going to, in many ways, be the perfect patient. And except for the fact that you may have high rates of overdose death in your patient population, you've got patients that will otherwise stick with you.
Because one of the other alarming statistics that you see with this opioid epidemic is the massive increase in overdose deaths. And it's both from the prescription painkillers and then also now the transition to heroin.
We do have a serious heroin problem, and that heroin problem is a consequence of people getting addicted to opioid pain medicines and switching to heroin. But this hasn't been caused by some crackdown on painkillers, and it's also not new. From the beginning of the opioid addiction epidemic, from the early 2000s, people who were getting addicted to opioid pain medicine, if you were young, if you didn't have medical issues, it would be difficult to get enough pills from doctors. So people would switch over to heroin if they lived in a part of the country where heroin was accessible.
So the people who still can access the pills, so we're working with partners who are doing research on this piece of the transition from the opioid analgesic painkillers to heroin and when it happens and what it looks like. And it seems like the people who can still, who are not just experimenting, but who have become addicted and still have access to pills will continue on the pills. It's when that access dries up. We also know that the price of pills has increased dramatically. We're when you develop an addiction and a dependence on it, you are consuming 10 pills a day, and sometimes pills are anywhere, they can range from $30 to $50 a pill. So it's a very expensive habit. And now heroin has become readily available and extremely cheap.
When you look at the overdose death rate of middle-aged Americans being prescribed opioid painkillers, they are significantly higher than they are for younger Americans, even the groups that are now switching to heroin. In states across the country, you have efforts to address this crisis, and in some states, legislators have tried to mandate that doctors use the prescription drug database before they write a prescription. It's a database that would tell a doctor whether or not your patient is getting controlled substances from multiple doctors. Of course, making doctors use that database would be a very good thing. A lot of doctors won't check the database unless it's required because they think they can look at a patient and know who has a problem. But medical societies, the medical establishment, has been fighting against interventions like this. And what I think the medical societies believe is that this is a problem of the bad apples. They'd like to think that the problem is bad doctors who are really drug dealers and drug abusers posing as patients, and that interventions focused on the majority of doctors and the way in which they treat the majority of their patients will be punishing the many for the bad behavior of the few. The reality is that it's the well-meaning doctors that are perhaps a bigger part of the problem because they are inadvertently getting their patients addicted or putting a hazard in people's homes.